Hi everyone, I am Dr. Gloria. Welcome to Ask Dr. Gloria. Welcome to my channel, where health and wellness are made simple and easy to understand. Learn smart and live well. That is our logo. Don't forget to like and subscribe and share with your friends about your wellness. And don't forget to share your questions you'd like us to discuss. I'm happy to help. So let's dive in. This quiz questions are multiple choice questions from different competitive and academic exam. You have 5 questions to answer each. Pause the video if needed, but I will try to pause as much as I can. If you need to pause the video to check your IQ, it's very important. Do that. This question is about foodborne pathogen bacteria. So, question 1. Question 1 says, which of the following statements about foodborne infection and food poisoning is true? These are two different things. As the medical student, health professionals, you should know the differences. So, what is the major differences between these two? Which statements are true about them? C. Question 2, very similar but different. Which of the following best distinguish food poisoning from foodborne infection? C. Question 3 is about matching. Like I always said, if you watch my previous videos, as a health professional, medical student, or any field of healthcare you are, you should familiarize yourself with different kind of type of questions. Okay? In these videos, we are treating MCQ, but different type of MCQ. So, match the foodborne pathogen with the disease it causes. A. Question 4. Question 4 is about clinical case. A patient presents with profuse rice water, diarrhea, and severe dehydration. Diarrhea always comes with hydration. Which organism is most likely responsible? C. Febrile cholera. Question 5. Clostridium botulinum is dangerously primarily because A. Question, before we go into the next question, I forgot I put some mnemonic for you to help you. So mnemonic is that botulinum is equals to, because it causes paralysis. So bottle paralyzed. So where are they found? Why do we put the bottle there? It's mostly found in improper canned foods. And that is why we say the bottle paralysis, right? Okay. Question 6. Staphylococcus aureus causes food poisoning. True? True what? B. Question 7. The other mnemonic is same thing as the other one that I talked about, by the way. So question 7, you can pause the video to look at it. Question 7, which E. coli strain is associated with sugar toxin production and bloody diarrhea? C. Question 8, which E. coli strain is characterized by diffuse adherence to intestinal mucosa, primarily affecting young children? B. Question 9. Before we go into question 9, always remember the E. coli strain. Okay, we have the E-Turks, which is primarily associated with travelers, like travelers diarrhea. The bloody diarrhea always causes the Hodge syndrome. Okay, And then we have the APEC, which is mostly associated with the children. Question 9. Which of the following bacteria require only a very small infectious dose to cause illness? B. Shiga. Question 10. Which of the following best describe the classic clinical presentation of febrile cholera infection? C. Question, yeah, see, I've given you, did I give you this mnemonic in this video? No. So, rice water plus febrile equals to what? Cholera. Okay, so you can say rice minus water stool equals to classic cholera sign. Okay, so you can use this mnemonic just to help you to remember, especially for clinical cases. Question 11. Which pathogenic group of E. coli is the most common cause of traveler's diarrhea? I just gave you a mnemonic now, so I'm sure you should get this. B is the one that is associated with the traveler's diarrhea. So I put it here again to refresh your memory. Question 12. Clostridium difficile infection in hospitalized patients are mostly commonly associated with what? B. Like definitely broad spectrum antibiotics use. They've been in antibiotics use for a long time. So I put an mnemonic here. Clostridium difficile risks, it increased after antibiotics destruction of normal gut flora. Normal gut flora, remember, they are the good guys, the good bacteria. We have the bad bacteria and the good bacteria, right? Yes. So the hospital acquire infection of Clostridium difficile, it's because of long-term use of antibiotics. Question 13. Matching. Match each organism with its characteristic of clinical presentation. So, as health professionals, you should get used to clinical presentations. This is the only way to be able to pre-diagnose, to be able to diagnose your patient. So, match. Which one is associated with which? We have C. You can pause the video to check the matching correctly. Question 14. Which of the following is true about Listeria monozygotogenesis? C. Question 15. I put a mnemonic here for you for the question. The Listeria loves the cold. So this is about the temperature in which they grow. Remember, they always love their optimal temperature. So Listeria loves cold. It grows in, they can grow in fridge, so they can grow between 0 degree to 4 degrees centigrade. So cold is not equal to safety when we talk about the Listeria. Question 15. Salmonella are most commonly transmitted through B. So I put a mnemonic here, right here also. Salmonella equals to undercooked pork, like poultry, by the way, poultry plus the eggs. That is where the eggs grow. So question 16. Why is Campylobacter jejuni highlighted as a particular significant food safety concern for food handlers? B. Question, I put a mnemonic here, you can check it as well. Also, this is about because the timing, okay? So the Campylobacter jejuniums, they need only a very tiny dose just tiny dose to be able to make you sick. Okay, just tiny dose is enough to cause an infection, very low dose. So yeah, infectious low dose determined. Question 17. Clostridium botulinum causes illness through which primarily mechanism? C. Question, I put a mnemonic here. I talk about it already. Canned food are mostly associated with the Clostridium botulinum. Question 18. Shigellosis, that is Bacillus dysentery, is primarily associated with which transmission routes? B. Question 19. A clinical sort of cases also. A student eats a cream-filled pastry at a party and develop vomiting within 2 hours. Guys, the student developed vomiting within 2 hours after eating a pastry. What is this telling you? This should tell you two things. Think about whether is it foodborne illness, is it food poisoning, before knowing the causative agent. So the question says the most likely causative agent is Staphylococcus aureus. This is preformed, right? Preformed toxin. This should tell you something. So put in the comment section, since it's preformed toxin, is this food poisoning? Is it foodborne illness? Put right there in the comment section. Question 20. E. coli, this is the strain of this E. coli, the E. coli 157, the strain of E. coli, the serotype of STEX, that can cause hemolytic uremic syndrome, the HUSH. This is most common vehicle of the most common vehicle transmission is what? The strain that causes the HUSH syndrome. The most common vehicle for transmission for this is what? B. I put the mnemonic here right here for you. I put it from the beginning as well. Question 21. Bacillus cereus is known to produce two distinct toxin syndrome. Which statement correctly describe them? B. I put that exam tip right here, the mnemonic for you also. So the Bacillus cereus about your rice, reheated fried rice. Most of this infection is about reheated fried rice. So this is a classic sauce, fried rice kind of. Question 22. To ensure destruction of salmonella in poultry, the internal cooking temperature should reach at least C. Question, I put a mnemonic here right here for you as well. The temperature which kills the egg, which kills the microorganisms in the undercooked. Question 23. Clostridium perfringens food poisoning is most commonly associated with Clostridium perfringens are most, they are food poisoning, definitely. So it's most associated with what kind of food food type? B. I put an exam mnemonic here right here for you to help you. Clostridium perfringens is equals to the caterers, right? Large batch of foods, of stews, of thick stews, by the way. Question 24. The fibrous Parahemolyticus is primarily associated with foodborne illness linked to, I'll read again, fibroid parahemolyticus is primarily associated with foodborne illness linked to B. Question 25. Which characteristics best distinguish a foodborne intoxication from a foodborne illness? Why do I keep repeating this question in different way? It's important for healthcare professionals to know the differences because you can't treat them the same way. Differences between foodborne illness and food poisoning is different. And also you need to know the symptoms. The symptoms are different. So what is the answer? C. Thank you so much if you've watched this far. I don't know which field you're from. Are you a medical student, a nutritional student, a pharmacist, any kind of professional you're studying or you've studied? Thank you so much for watching. Until next time, I remain Dr. Gloria. Don't forget to like and subscribe. Please put down the next topic you would like us to talk about. Thank you.